Hi, I am Dr. Cheolsu Shin. I'm a neurologist and epilepsy specialist working at Mayo Clinic in Rochester, Minnesota. And I am the chair of the section of epilepsy here in this institution. And I take care of patients with epilepsy in terms of managing their seizure disorder with medication, as well as with potentially surgical treatment. The EEG, which is electroencephalogram, is the brainwave test that we measure with electrodes placed on the scalp of the head. And of course, there are a lot of electrical activity going on in the brain, and that's what we record. And usually it is done as an outpatient in a specialized place, which has to be electrically shielded. And it's usually just half an hour or so. That helps us to understand how the brain is working electrically, and abnormalities that we look for an epileptic condition can be detected. Well, for the outpatient procedure, we usually like to have some sleep during the recording. And since these are done during the day, sometimes patients find it difficult to go to sleep during the test. So we usually encourage them to not sleep much the night before. So that's a sleep-deprived condition. And then when they do have that sleep deprivation, that in a way adds a little stress to the brain that makes the epileptic condition to become a little bit more active so that we could detect the epileptic condition better. So that's the preparation, if you will. Once the patient comes to the EEG laboratory, then the patient's scalp is prepared in a way by the technologist. And that does require some scrubs and rubbing, which some patients find a little bit uncomfortable. And then their electrodes are glued to the scalp. Taking that off can be a bit messy. So those are some of the things that I think I hear patients talk about. Otherwise, it's non-invasive study. We don't give anything by IV or anything like that. So otherwise, it should be a painless process. There are other reasons that we use epileptic, or we use electroencephalogram, and that is to exclude the diagnosis of epilepsy. So there may be other conditions that may mimic epileptic condition. So those we would also record with EEG. In the outpatient setting, usually the ordering physician, which would be usually a neurologist, will get the results from the EEG laboratory within about 4 hours or so at Mayo Clinic, which is quite rapid return. The EMU, or Epilepsy Monitoring Unit, utilizes that EEG recording continuously as an inpatient for several days at a time. And along with the electroencephalogram, we record a number of other things, including video and audio that records patients' activities. We also monitor the oxygenation, cardiac status with the electrocardiogram, and we do have the staff interacting with the patient and testing and so on. So the purpose of that is to actually capture the events such as spells that the patients have or epileptic seizures that they have, so that we can identify them and characterize them. So they do have to be prepared to be confined like that for several days, and that may be something the patients find a little bit daunting at times, but most people do well. In the hospital setting, the epilepsy specialist actually takes care of the patients as an inpatient unit, and they will usually make rounds every day and update the patients and the family of what had been found up to that point. So it's pretty much fairly quick return of information and counseling for the patients. The results are reviewed by epilepsy specialists with a specialty training in interpreting electroencephalogram and dealing with epileptic condition, so-called epileptologist for the clinician and the electroencephalographer for the EEG. So because epilepsy can be very resistant to medical treatment, medications, sometimes we do resort to surgical therapy, and to evaluate for surgery, we do need to characterize the epileptic seizure much more carefully. And that requires this intensive monitoring with all these parameters to know exactly where in the brain the seizures start. So we always encourage patients to have the neurologist at home work with them and us together. I think that's the best way for the patient's sake. We analyze these results and counsel the patient, but we also usually send a letter with records and all the results and our recommendations to the patient's physician